Allison Winnike, President and CEO of the Immunization Partnership. And I have with us today Dr. Kalyani Sonawane. Before the coronavirus pandemic, we saw a resurgence in cases of vaccine-preventable diseases in the United States, and particularly here in the state of Texas. Dr. Sonawane, to what do you attribute this resurgence in cases of these vaccine-preventable diseases?
So, Allison, long before we had the COVID-19 pandemic hit us, there was another pandemic, which we call Infodemic, going online in Texas and also in US as a whole. And that was a vaccine misinformation and myths about vaccines online. With people getting on social media, it has become so easy for people to make a Facebook post that has not been factually validated, or make that tweet out or send that tweet out that does not support or is not well supported by evidence. And a lot of people read these tweets. A lot of people are interacting with anti-vaxxers online. And what's that's doing, it's basically eroding the confidence in vaccine among people, especially in Texans. And as a result of this infodemic, what's happening is that we are seeing a lot of people who are trying to opt out of vaccine requirements. So another emerging trend that we've been noticing in Texas is that a lot of parents are filing for non-medical exemptions, meaning that they do not want to get their child vaccinated and want an exemption from going into school, which tells us that there are a lot more kids out there than 5 years ago or 10 years ago who are not being vaccinated against these preventable diseases. And that is one of the most important factor that has been contributing to these uptick of vaccine preventable diseases. So it's a combination of an infodemic and a combination of people opting out of getting vaccines on time, which is resulting in a rise of vaccine preventable diseases in Texas.
And one way to really make sure that we target vulnerable areas is to make sure that we have good data on what the immunization rates are. Can you tell us a little bit about one of the great tools we have, the Immunization Registry, and how we can use it to help understand the immunization rates and figure out ways that we can improve those rates so then we can really keep these diseases out of Texas once and for all?
So we have a Texas Immunization Registry, which is in place, a sort of centralized system where the healthcare providers can submit information on what immunizations individuals are receiving and when they are receiving and whether they are up to date on their vaccination schedule. What this immunization registry does, it is basically a backbone of public health infrastructure in Texas. But currently it is very limited in terms of the capacity it has in terms of informing and decision making. The registry we have currently has voluntarily submitted information in there. We do not have 100% view of all the individuals living in Texas. So we're only seeing a few lives or a few records of all the Texans who are currently residing in this state. The other issue with the current registry is that it is not as modernized as some of the other immunization registries in some of the other states, which allow us to do some useful things like sending text reminders or sending emails informing them about how the vaccines are beneficial and what are the safety profile of these vaccines, so that even before these individuals come to the physician's office, they're already well informed about the safety and effectiveness of these vaccines.
So if we had a really strong and robust registry that had everyone participating in it, could we use that as a tool to help with the equitable distribution of vaccines across the state? And I'm even thinking with the coronavirus pandemic, the rollout of vaccines to cover all 29 million Texans.
Absolutely, Allison. Because this system will have information, if in future we make it mandatory for all providers to submit information, it will allow us to basically pre-look of what the needs of our population are. It allows us to see what populations are not getting vaccines, it also allows us to pre-plan and send vaccines in the areas where they are needed. What that does, it improves the efficiency of the vaccine distribution system, and it makes the vaccine available to areas and to individuals who may not be currently getting those vaccines.
So it sounds like if we can have a really strong, robust, and modernized registry, that then we'll be able to have quality, real time data related to vaccines so that then we know where we need to have more vaccines deployed, making sure that both in our rural and in our urban areas that all the folks that live in those communities have access to those vaccines.
Absolutely, Allison. I believe that having information from the immunization registry is going to be key, not just to the distribution, but equitable distribution of vaccines and immunizations across the state of Texas.
Well, thank you so much. I really appreciate you sharing your expertise with us today. And I invite our viewers to check out our website at immunizeusa.org for more information about the immunization registry and also immunization policies in the state of Texas.